So I'm actually not going to talk about genomic data and pathway data too much. So I'm going to break some of my own rules that I laid out this morning, except just there's a little bit of a tongue-in-cheek assessment of these data sets, because I think in comparison to some of the other data sets we're dealing with, there are fewer issues. So in that sense, the genomic data is not quite like the others. It's exponentially big, but comparatively homogeneous. And I realize this is, there are some caveats to this, but sequence data is sequence data, and it's been around a lot longer. And I think in terms of this whole idea of standardizing data and making repositories and making data publicly available, genomics was really sort of setting the stage for all of these other data streams that are now sort of following suit. So there certainly remain issues in terms of quantitation, doing these high throughput studies. Can you compare across studies? How do you normalize the data? And I'm going to kind of gloss over all those because I think there's a strong awareness of this and there's capability, and I think it's a matter more of fine-tuning at this point. As far as archiving and availability, I think, as I said, genomic data, sequence data has a unique history in comparison to other data sets, and I'm talking in the context of environmental health data. There are clearly public repositories that are out there. NCBI and EBI really sort of cleared the path for that. Public analysis tools followed. And there are a lot of data standards by comparison. So, things as simple as FASTA. How do you store sequence data? This seems so trivial now, but there was a time when we didn't have those kinds of standards. And so, and bioinformatics as a field essentially grew up around genomics data. So there's been this huge focus on genomics data, sequence data for quite a long time. And we still obviously have issues to work out, but we're, as I said, again, in comparatively good shape. As far as sharing, obviously not everybody shares as well in the sandbox as others. My son is a perfect example of that. But there are certainly mechanisms by which people can share, and that's, I think, different from some of the other data sets. And small, which are turning out to not be so small, things such as publications and journals getting on board and saying, hey, we're not going to publish this until you make this publicly available, is very similar to some of the things that were brought up earlier today. If you have this pressure on the community, you can overcome some of these things by brute force, and I think that's not necessarily a bad thing. So there are issues that are sort of unanswered, and we deal with these very large and heterogeneous data sets. They're not relevant to all areas of the biological community. So what do we do about centralization? And I don't have an answer to some of these questions in orange, but they keep popping up. So is centralization really appropriate in all cases? Is it appropriate on particular field or niche levels? And is that even possible? So we start to deal with these gigantic data sets. We can put things in the cloud. Maybe that's the solution. I think we haven't quite made that full transition yet. So what's happened, instead of people necessarily submitting all their data sets to a public repository, they're making them publicly available in their own private sort of way. And this is, I think we're in this in-between stage where we have a lot of data that's publicly available, but it's very distributed. And so it's difficult at this point to figure out exactly where it all is. So as far as capabilities and analysis, I think genomics data is arguably ahead of the curve. And of course, as I said this morning, I'm going to ignore a whole bunch of issues like storage, capacity, privacy. And as I expected, a lot of these issues have kind of come up over the course of the day. So as we've seen in environmental health sciences with Tox 21 and a lot of new language coming out in toxicology and talk of mechanism, and I know in a project that I've been working on for a number of years that I'm going to talk about in a little bit, I was always saying, well, we need to know the mechanism of chemicals, and it was very frustrating to me that there was very little pathway data. There was very little, well, we need to understand which genes are actually affected by chemicals. We're just going to kind of dump a bunch of chemicals on something and count how many died, and we haven't really learned anything more about what the chemicals are doing. And so it's been very gratifying to see this sort of shift to, well, it might be really important for us to know something about the mechanisms by which chemicals exert their effects. And this is both in the environmental health world, and I think there's a corollary in drug discovery, only they have, I think, been more interested in targets and molecular mechanisms than the environmental health science community for some time. So pathways are now becoming more important in environmental health science. And fortunately, as I mentioned down here, we have the benefit of a lot of this pathway data and analysis efforts being built on somewhat structured data. So expression data, transcriptomics data, genomics data. But in terms of pathways, you can see that as you look through the literature, pathway predictions pop up everywhere, and I am guilty of it too. But there's certainly a lot less consensus in terms of definitions. So what really is a molecular pathway, and what's the underlying data that defines how we try to predict a pathway? How do you interpret the pathway? I mean, we've all seen these gigantic hairballs in papers, and people think, wow, I did all this analysis, and look, I got a hairball. It's like, okay, well, what have we learned? Have we really learned anything else? And so I think there's a lot of work that needs to be done in terms of, I think it's great we're talking about pathways and mechanism, but I think we need to kind of hone that in a little bit and think about what actually is this pathway information going to be based on, and how are we going to use that to improve understanding about environmental health. There are also issues, I think, in terms of the data that people actually leverage to make these pathways. And so variability in the sources of those underlying data sets, the quality control of these data sets. And so while I think we've made some steps forward, we kind of need to look back a little bit more and define this idea of pathways a little more clearly. So that was kind of my nod to what I was supposed to talk about. And I do think those data sets are in pretty good shape. I think the challenge, though, is really going to be taking those data sets and bringing them meaningfully into environmental health science data. And that's going to be, how effective that is going to be contingent on really the state of these other data sets. And we've heard a lot about the health data, which is really interesting and challenging in a whole set of areas that I'm kind of glad I don't have to deal with, because it sounds really scary. But I'm going to talk about a couple. I hope this is actually a good segue into the next two talks, because there are data streams, and this is more trying to illustrate the example of, in a smaller scale project, taking these heterogeneous data sets and how do we start pulling them together to talk about looking more globally at the complexity of environmental health. And I'm hopefully going to frame this or anchor it in genomics and pathway data. So this is a project I've been working on for a number of years, the Comparative Toxicogenomics database, and this is a manually curated database. We use ontologies. We use existing data that's out there. We use the literature, so I'm well aware of all of the agony of dealing with ontologies, dealing with the issues associated with literature and the lack of accessibility to the information in terms of, text mining and things like this, just based on the type of data that we have available to us. So I'm going to just talk about initially the chemical gene disease. So the goal of this database has really been to try to help users inform hypotheses about connections between chemicals, genes, and diseases. So what are the targets of these chemicals? What are potentially the pathways that they affect? And if we're thinking about diseases and the environmental influences on them, can we understand something about those underlying mechanisms that can help us understand the etiology of these diseases? So it's freely available at that URL, and I'm just going to show you a couple views of the data. You can query it by genes, chemicals, diseases, a number of different ways. And here's just an example of one particular chemical. It's an insecticide that, chlorpyrifos, it was banned in household use but is used widely in agriculture. And quite a bit is known about the mechanisms of this chemical, actually. But I'll show you along this top bar is an illustration of the kind of data that we integrate with chemical data. This is a text-based view of the curation that we do. So we curate chemical gene disease or chemical gene relationships. And when I say gene, I'm also talking about proteins. And so that you don't have to read this generalized, we have very simple binary relationships, like a chemical has an effect on a gene and its expression. Or we can say co-exposure of chemicals, so we try to have some representation of co-exposure. We can have a chemical having an effect on a chemical having an effect on a gene. And so it can become more complex. And so we use these data sets as kind of a foundation then to also connect these mechanisms to diseases. And so we have a number of different ways that we connect chemicals to diseases, and that's through curation, also through inferences based on underlying genomic and gene expression data. So we can give you kind of a highlight of the categories of diseases that are associated with exposure to this particular chemical, and I'll explain more about what that curated and inferred coloration means. But you can, this is a very high level view, and you can see that just get a quick glimpse of a chemical that this is affecting nervous system diseases more heavily than, say, connective tissue diseases. So if you go back here, you can see our chemicals. These are diseases with which we have curated relationships, and you know that when you see an icon in this direct evidence column. And so, but in many cases, as you might predict, we have fewer examples of where we know an environmental exposure is correlated to a particular disease. And so the bulk of our relationships are based on inferences, and you can sort this by an inference score, and I won't get into the statistics underlying that here, but we actually just published a paper in PLOS One talking about this analysis. But essentially, what this is based on is the fact that we have curated relationships between chemicals and these genes, and then also curated relationships between these genes and these diseases. And so what we end up with, and a lot of the times where we have a curated chemical disease relationship, it's often based on an epidemiological study with no known mechanism underneath. So we feel like this is a really important and unique gene set that could potentially help explain some of these correlations that are found through epi studies. And so what we're doing now is taking these gene sets, we do some basic Go and enrichment analysis of already curated pathways from places like Reactome and KEGG, but now we're also taking as many data sets as we can that are publicly available that talk about protein-protein interactions and building our own pathways for these particular gene sets. So rather than saying, well, these genes may help to explain this connection between this chemical and this disease, what do we know about the existing relationships or known relationships among these genes? And so now we're able to provide, and this is a pretty small one, actually provide pathway information about those particular gene sets, and with that based on the underlying data sets that are publicly available elsewhere, we can give some idea about directionality. So this is giving you a view of a potential pathway that would explain a potential connection between a chemical and a disease. And again, it's a hypothesis driving tool, so this is, we're not saying this is exactly what's happening, we're saying that there's enough data underlying this that it might be worth pursuing in terms of thinking about the mechanisms driving a relationship between a chemical and a disease. So one of the other projects that we're working on, so there's a lot of interest in exposure data. This was something I knew nothing about 3 years ago. And an example of trying to integrate heterogeneous data within our existing database. So became clear that, and I think Elaine is probably going to talk about some of this later, but we started working with the exposure data curation or exposure data community, largely driven by Tina, who's sitting there quietly in the back of the room, and realizing that the exposure data community needed a way to centralize their data. They needed a way to integrate their data with other biological frameworks, and we thought that CTD might be a good place to do that because we already had some of the data sets that they were wanting to connect to, some of the molecular data. And so being a curation team, we started saying, okay, great, let's see what we can do, and sit down, where are the data sources? We had no idea where the data sources, they're very distributed. There's some in published literature, there's some in government reports. So do we have access to these data sets? And that's variable. And then, okay, well, if we're going to curate, as much as I do not like building ontologies, I become more and more involved in them. And we can talk about ontologies till the cows come home, but they are actually, for us, a necessary evil at this point in time in order to, in a structured way, capture information. And there were no ontologies for exposure data. So we coordinated a team of people in the exposure world and our world and the ontology world and put together ultimately the framework for an ontology that now we're using, and also working with the community to say, okay, well, if we're going to go through this effort of curating the exposure data, what exactly do you need? What are the questions you want to answer? And of course, everybody wants everything in an exposure project, and it's not feasible. So we spent a good year figuring out what was actually possible for us to curate. And we've been doing this for the last 6 months and have quite a few papers curated. I think we're over 1,000 now. And so it's not publicly available in CTD yet, but will be probably by the end of this year. So it was a very interesting experience to go through, working with very different communities that had ultimately very similar goals, yet we hadn't previously talked to each other. And thinking about that process of, well, if we want to put this stuff together, what do we actually have to do? And we have to have these kinds of conversations and think about the resources that are needed to make this happen. And it's not trivial. And then I just want to touch on one other thing. So one of the limitations in CTD and for other, I think, resources that are trying to deal with the chemical space is the limitation on how do you represent chemicals. And I'm not a chemist. And so then we found when we started thinking about, well, how do we do this, that there's a lot of division among the community in terms of how do you represent chemicals. So we had taken kind of a low-hanging fruit approach and used an existing vocabulary through the National Library of Medicine, always knowing that this was not the ideal way of doing it, and have since started collaborating with Chihei Yang, who many of you know, and looking at various other sources, so traditional toxicology sources, and she is a computational chemist. Is that appropriate to say? She calls herself different things. And we actually just put in a grant to the EPA with her, but it will be extended. That was sort of experimentally based, but now we're working on a way to think about chemical structure. And so in our database, you can come to look at a disease or a gene and find a list of chemicals, but the list of chemicals is only so informative. And so if we have a better way of saying these 100 chemicals, you can actually distill them down to say, 5 different concepts, chemical concepts, or chemotypes, as Chihei would call them. And so we're looking at how we can use gene expression data using CTD to look at what chemicals are known to interact with those genes in these high throughput data sets, and then thinking about what we can learn about the commonality of which chemicals are having similar gene expression profiles, and putting this on top of the chemical data that's in CTD already. And so again, this is a coordinated effort across disciplines, not easy. And always there's this language difference between these communities. I'm finding that, again, and in this example as well, we want the same thing in the end. We want to understand and improve the ability to predict toxicity from chemicals. We're coming at it from very different ways. But all these data sets are really complementary, and it takes a lot of work to actually bring them together. And so I just sort of have some high-level thoughts about what I think is needed. And I think really mechanisms, both financial and social, and the social has come up a lot today about, you know, how do you actually bring people together from different communities that speak different languages, have different disciplines, but that actually have data and common and interests that are common to each other. And I think bringing these people together in forums like this actually do a lot. And I realized as I was putting this point together that this collaboration with the exposure data, this collaboration with Chihei and the structural chemistry actually came out of these NAS meetings. And I think there's a huge opportunity for this kind of thing where we have people that come into the room. They're not necessarily in the same field, but they're giving examples and they're talking about scenarios and analysis strategies that can actually be leveraged across the board. And then just a final comment that I think, you know, we hear about really big efforts and we hear about little mom and pop efforts, and I think there's, in some conversations I had with Stephen Friend before this meeting, I really liked his idea of citizen science, and although what I'm talking about is not necessarily citizen science, it's sort of this across the spectrum of having this inclusive approach to how do you find data, how do you integrate data, and having communication and input from a lot of different pockets of science. And then finally, long-term planning for sustainability, and I think we'll talk about this more tomorrow, but for all these efforts, they require funding. They require collaboration and a social structure that's going to allow people to do this in a way that's going to be fulfilling and successful, and nobody gets left in the dust. So I will stop there, and that's it.